Living donation, TO.
Living organ donation is one of the best treatment options for so many chronic diseases that we treat at UHN. Compared to before transplantation, living donor recipients cite improvements in their overall quality of life. However, psychosocial distress and physical dysfunction tend to reduce quality of life in our living donor recipients compared to the general population. See, these disparities in living organ donation go beyond medical diagnoses. Researchers at Toronto General have shown that patients belonging to ethnic minority groups are less likely to undergo living organ donation. Differences in ethnicity, race, religion, and spoken language all lend to these lower levels of living organ donation in certain communities. Imagine those who may not speak English and the difficulty in navigating the living donation process without resources in their language. Think of how it may impact their journey in finding a living donor and getting this life-changing treatment. Knowing that living donor recipients cite some difficulties in coping with physical, mental, and social distress, it's important that we support patients in creative and inclusive ways. Now, the beauty of technology allows for comprehensive online support platforms to easily bring resources to patients, empowering them to take charge of their healthcare experience. They can also serve to bring patients together, granting them additional emotional support. Yet, existing online support platforms do not highlight different cultural and religious perspectives, and online culturally sensitive resources end with simple translations and fail to address the values and norms of diverse populations.
It's clear that current social support for potential living donors, patients, and their families is failing to meet the demand for culturally tailored resources. This is where Living Donation TO comes in. Living Donation TO is a web-based platform that aims to fill in communication gaps by facilitating heartfelt and informative discussions around living organ donation. We want to address long-standing psychosocial and ethno-cultural barriers by working with patients, donors, and families from various cultural groups. This platform will offer population-specific information modules on living organ donation and resources for social support, stories of lived experience with the disease used to tailor content to include cultural nuances, discussion forum with the transplant community that is confidential and monitored by social workers and volunteers equipped with the resources to offer emotional support and referrals to physicians and experts. Cultural competence resources for healthcare professionals and potential donors to better communicate while considering Toronto's cultural diversity.
Moving forward, Living Donation TO will act as a conduit between UHN's Center for Living Organ Donation and local communities and cultural organizations identified from our group's past collaborations. UHN staff and community volunteers with specific ties to the cultural groups of interest in the GTA can facilitate this process. Through consistent updates and evaluations, we will improve Living Donation TO's ability to provide culturally specific, emotional, and informative support virtually. Surveys and interviews at launch, as well as opportunities to elicit feedback afterward, are a couple of ways to achieve this. In the long run, we want to adapt our platform for mobile for easier access to resources and stories from various backgrounds anytime, anywhere, and by anyone. If you support Living Donation TO's aim to provide culturally inclusive social support for living organ donors and recipients in Toronto's diverse communities, please vote for us by liking this video.